This week's topic is quite relevant and topical and quite close to my heart because this is about exercise around menopause. You probably already have a routine that's working for you and you've been doing it for years. So you may wonder whether you need to do anything. But just stay until the end of this conversation because there is some science backed, research backed evidence to say that menopausal women probably do need to consider a different kind of approach to the falling hormone levels and why it is relevant. Menopause and movement, why it is just not good to exercise, but it is quite essential if it is somebody who hasn't been doing any exercise in life to start doing it now. Let's talk about the physiological changes that happen in our musculoskeletal system. By that, I mean our muscles and bones and ligaments, especially around perimenopause and menopause. So, be it man or woman, it doesn't matter. As we grow older, we do have a certain loss of muscle mass. We peak our muscle mass in late 20s. So after the age of 30, all of us do have reduced muscle mass and it declines by 3 to 8% per year. This is not inevitable. Obviously, they could be much slower for some people, and some people do retain or even build. There is research showing that you can build muscle even at the age of 70. But that's the natural progression if we don't do anything about it. But having said that, women have it differently. So around perimenopause and menopause, the rate of decline is much more rapid, and it is up to 1 to 2% per year. So if you take 5 years or 10 years, it's going to be 10 to 20%, which is much significant risk compared to men or women before menopause. And not only that, the fall in estrogen levels also cause changes in the cells that stimulate the bone resorption or bone growth. So they increase the activity of osteoblasts, which are cells that cause osteoclasts, and reduce the effectiveness of osteoblasts, which are the cells like bricks that make the bones. So we do have more risk of osteoporosis around menopause. And obviously lack of collagen or reduced amount of collagen around menopause causes the joints and ligaments to be stiff and also more risk and prone for injuries like Achilles tendonitis, frozen shoulder, bursitis in the hip. So I see a lot of women coming with these problems than hot flashes around menopause. So, and most people are not even aware that this is a menopausal change, a menopausal hormone change that's triggering all this. So, having listened to all this, you know that exercise around perimenopause and menopause is not just for weight loss or looking good or fit. It's about retaining the muscle mass or growing the muscle mass and also strengthening the bones and reducing insulin sensitivity, which is again another thing that comes with lack of estrogen, that we all have high risk of developing diabetes. So all of this can be mitigated by exercise. Most of you probably know that there are two main forms of exercise. Aerobic exercise, which is your running, walking, jogging, cycling. So anything that stimulates blood supply, circulation to you, all the parts of your body, including your heart. And anaerobic exercise, which is more like HIIT training, strength training, resistance training. There are benefits with both types of exercise around menopause, both do different things. With aerobic exercise, obviously, it increases your cardiovascular fitness and enhances your insulin sensitivity, so less risk of developing diabetes. And also, obviously, it's improving your mental health because you all know how good you feel after doing a workout. But there are limitations to this exercise, especially around menopause. It is probably not the best form of exercise to build lean muscle mass or increasing the bone density. And also, it may not enhance the estrogen levels as the resistance training does. So, with anaerobic exercise or resistance training, there is definitely a proven research evidence to show that increases the muscle mass as well as muscle strength, improves the bone density, and it is definitely more effective than aerobic exercise in raising the estrogen levels. I would like to quote two probably relevant studies, although there are many more studies like this. There is a 12-week randomized control trial by Abdul Razak showing that there is increased, evidence with in support of resistance training. So they have put women through aerobic versus resistance training by dividing them into two groups, and definitely there is increased amount of estrogen level seen in women who have done the resistance training and reduced fat mass as well as increasing the muscle mass in the resistance group. And the best part is that women who did the resistance training had to spend only half the amount of time as the women who did only cardio. So less time, more benefit. The other relevant study is called Lift More, which is quite a relevant name, I feel. It is done in Australia. And these are women who already had osteoporosis. So they already had thinning of the bones happen, unfortunately. But they have put women through this 8-month supervised exercise program, again resistance program and weight based training, and they have all shown improvements in the bone density. That means their osteoporosis got better, and moreover it proves that even if somebody has osteoporosis, it is not dangerous to lift weight. And by weight, I mean for anybody like me, I'm not looking at lifting massive amount of weight. It could be your body weight um, exercises, but they're done in a way that they're structured in a way that they put impact on the muscle, on the bones, that stimulates the muscle growth, stimulates the osteoblasts that are the remodeling cells for your bones. So, final take home message for today is obviously all exercise is good, no exercise is bad, they have their own benefits. But around perimenopause and menopause, there is definitely more evidence that resistance and strength training has a major impact on the bone density as well as muscle mass and preventing sarcopenia. So please consider this, and if weight training or strength training is not part of your routine, include that. And the other one that I would like to mention is training to improve the flexibility. It could be gentle stretches or using Pilates, yoga, but stretching as well as strength training should be part of perimenopause and menopause exercise. Thank you.